Hi there, and welcome back to the Uterine Nurse. I'm Michelle, an OBGYN nurse practitioner. Today I want to dive into the perimenopause topic about what is hormone replacement therapy and the 4 types of hormone replacement therapy that are out there. So we're talking about FDA approved hormone replacement therapy. You're more than welcome to work with a naturopath to kind of come up with kind of non-tested things on a large scale. But I'm talking about the main types of hormone replacement therapy that have been tested in randomized controlled trials and are shown to be safe and effective. So hormone replacement therapy is exactly what it says. It's replacing the estrogen levels that are lost from going through perimenopause, menopause. The ovaries are not functioning the way they used to, so we need to supplement estrogen because now we're starting to have symptoms, okay? Number 1 form is oral bioidentical therapy, which is just oral supplementation of estrogen. This is a really basic entry level way into hormone replacement therapy. The thing with the estrogen oral treatment, in addition to another form that I'm going to mention for the second, is that if you have a uterus, you have to have some type of progesterone in addition to the estrogen. The reason for that, and the simplest way I explain it to my patients, is that estrogen is like fertilizer for your uterus. It's going to cause the lining of your uterus to multiply. And if that goes what we call in the medical community unopposed, meaning there's nothing there to stop the overgrowth, those cells can become cancerous. So you have to have progesterone as like the lawnmower to stabilize the lining of the uterus. If you do not have a uterus, you don't have to worry about that. So that's the simple way to put it. So there's oral estrogen, but oral estrogen, if you start to have other comorbidities pop up, high blood pressure, diabetes, smoking, even if you maybe have some clotting stuff in the family history, not if you have a clotting disorder that you cannot be on estrogen therapy, but if you have some type of family history, any of those things that's going to elevate your risk of clots with estrogen, a patch, number 2, is the other and most effective option. A lot of people tolerate it very well. The only issue a lot of my patients will have with it is that it doesn't stick to the skin because you have to change it. And there's combo patches that have progesterone in them as well, like we just talked about. If you have a uterus, you need that progesterone so you don't have that unopposed estrogen acting like fertilizer for your uterus. So you can use patches as well. And the beautiful thing about patches in patients that have any type of comorbidities is that it bypasses the liver and bypasses that what we call first pass effect. And it's the processing of the liver that the liver has to do with the medication, with the hormone that can cause clots. So patches are number 2. Number 3, topical estrogen. So more so for down below symptoms. So we're talking about vaginal dryness, painful intercourse, constant UTIs, having urinary leakage, urinary incontinence. We giving estrogen back to that pelvic floor to give it the support that it needs. So that's number 3, topical estrogens. And number 4 is a non-bioidentical form, and this is what a lot of breast cancer patients sometimes will be put on to help mitigate hot flashes and night sweats, and that's mood stabilizers. So your SSRIs, so your antidepressants are another word for them. And a lot of times that works really well because a lot of patients, a lot of perimenopausal individuals are going to have emotional symptoms associated with going through perimenopause. So putting them on an SSRI is going to help with hot flashes and night sweats. And SSRI is just a fancy abbreviation for serotonin reuptake, selective serotonin reuptake inhibitors. So it encourages the body to absorb more serotonin and prevents it from not, essentially, so that you can get those effects, so it helps to elevate the mood, right? Because serotonin is the happy hormone, so to speak, on simplistic terms. So giving a mood stabilizer can actually, in certain doses, help with not just mood stability and stabilizing the mood, but it also helps with hot flashes and night sweats. So that's another common one that we'll give. So those are the 4 types of different forms of hormone replacement therapy. And I hope this was informative about that. If anyone's looking for kind of some just kind of cut and dry information on what is hormone replacement therapy, what are the types of hormone replacement therapy, am I a candidate for hormone replacement therapy, all of those things. So I hope that was helpful. And if this video was helpful, please like, comment, and subscribe. Love it. And so that I know that this is good informative information. And you can also follow me for kind of more personal things on my Instagram at the.uterine.nurse. Or if you have a low attention span and you want like little snippet video clips, you can hit me up on TikTok at the uterine nurse. Take care.